you. Thank you for your lovely introduction. I appreciate it. You've taken a lot of trouble.
It's our privilege and pleasure. You can start, ma'am.
Yes, so I want to hear exactly what your audience is waiting to hear, because I don't have a prepared format. I wanted to be able to tell you what you all want to hear. So if you give me some questions, we'll address it.
Anyone question can ask her.
So are you interested in the Manasi project? Are you interested in knowing exactly what that model is? Are you interested in knowing about COVID? Because I had been posed a number of these questions, and I will try to answer them more as a conversation and not as a lecture, so people can ask questions in the chat room if you want. And if there's something that you wish me to address, I will. So shall we start off by explaining the Manasi model to you?
Geetha, Mahi here.
Yeah.
Can you, we are just like to hear from you about you are the specialist in the psychiatric field. So during this pandemic, the psychology issue has becoming a very big issue actually in our life.
Yes.
So if you start with something about on that part, during pandemic, what would be how we can have the wellness for our mental issues? This is the number one. You can have a little say on it from your expertise part. And then we would also love to hear from about the Manasi model as well. Manasi is very much recognized by WHO, if I am not wrong, and that is a very good project that you are running in India with one of the districts.
Yes. So let me start out this way. Ishwarama was the first person I saw in the village of Mugalur in her home 22 years ago. Ishwarama's family told us that she used to work in the fields with her husband regularly in order to derive an income for their family. Ishwarama decided that she suddenly couldn't sleep at night, she couldn't eat, she had lost a lot of weight, she became very anxious, panic-stricken, wouldn't leave the house, and couldn't even attend her own daughter's marriage. For 2 years, she had not left her home. She wouldn't get out of bed. She had no longer expressed any energy to do work in the home or in the fields to help her husband. With the Manasi caseworkers, we visited her home. We recognized that Ishwarama had symptoms and signs of what is called major depression. It was complicated by panic disorder and what we call agoraphobia, or fear of open spaces or fear of leaving the house. With our treatment and with our consideration for the fact she could not leave her home, with medications, with encouragement, with education, her belief that a demon had possessed her body changed to understanding that she had depression, which was a completely treatable illness. In treating her, she was able to gradually come out of her house. And to this day, Ishwarama is on our books as a continuing patient who has been very well now for 22 years. Why am I telling you the story of Ishwarama? Depression and anxiety are the two most commonly encountered disorders in the world across all cultures, all races, all ethnic groups. This has been verified and demonstrated by many studies done extremely well by researchers across the globe. The second most prevalent illness is alcohol abuse or substance abuse, which is another entity that's present across the world in every culture. So in the village of Mugalur, for example, alcohol is not Johnny Walker or Hennessy, something from the top shelf. It is country liquor manufactured in the village with very little understanding of what concentration of alcohol there is. So in conducting an epidemiologic survey, which we did in our villages, for 17,000 households door to door, we also demonstrated that these were the two most common disorders. Now, in the light of COVID, or in the light of a pandemic, which is extraordinarily anxiety provoking for all of us, not just someone with an illness. Imagine then someone with an underlying depression or anxiety has felt this a lot more profoundly than you or I. So being trapped in the house, being alone or feeling alone, feeling that social distancing has somehow prevented you from contacting loved ones, from not actually going to work, and in many parts of the world, losing your job, not having an income is an extraordinary event that causes heightened anxiety for not just somebody who has had anxiety in the past, but even for people who have been well. When you look at frontline workers like doctors and other staff that run the hospital with us, you find that their anxiety is not only high about contracting the illness and taking it home to their loved ones, like their children or their elderly in the home, but also their anxiety is increased because they are now resource poor, which means that the job of 13 residents on an inpatient unit is now done by 6 because they have to be spread out so thin. Would everyone mute their phones, please, because there's a noise interference. So there is anxiety caused by fear of contracting the virus, but there's also anxiety caused about taking the virus home to loved ones and infecting others in one's home. Besides that, what else causes anxiety? You have to do things that you never did before, where you might have to go out of the way to procure your groceries. You might have to dispense with servants in your home. I know if you were lived in India, you had 5 or 6 servants in your home. Now, essentially, you have to take universal precautions, which means you have to understand that anyone can bring the virus into your home, even if they appear well. They could be carrying the virus, but they be asymptomatic. So the important thing is for you to understand that there are many changes you have to make in your life that you've never had to do before. So somebody who relied on someone else to come and cook for them, clean for them, they may be now in a situation where they have to do a number of these tasks. So there is heightened anxiety if people are resource poor. And the last thing is that they don't know if they lose their jobs unless you are IT trained and you can do your job remotely. They're frightened about not having enough help for their children. Schools are closed, which means that there is an increased impact of doing extra work in the house because you have to now train your children to sit in front of an iPad or a computer in order to complete their school courses. So there is a bottom layer of illness that we talked about. There's another layer of actual anxiety because of the real concern about the virus. And the third concern is having to do extra tasks that one has never had to do in the past because one has to accommodate to the pandemic. And the uncertainty of not having a cure, not having an end point in sight, and not having choices of what to do when you actually contract the virus, that is another concern. Now, if, for example, you were told, look, you have chicken pox, these are the signs and symptoms, and the chicken pox takes a certain course, you are infectious during this period when your family has to take some extra precautions, and the course of the disease is such that it lasts a certain number of days, and pretty much you're non-infectious after that, that would be very comforting to people because they would know precisely what to do during what time. This, however, is not clear with this virus, which we have never dealt with in my entire lifetime. I've never seen anything like this. So there is uncertainty. Given that uncertainty, there is an increased experience of anxiety. So what does one do in terms of dealing with day-to-day anxiety and how one responds to this? there are only 3 things one can do because we're all in that at-risk population. So when they say who is at risk, it is not true anymore that only elderly are at risk, young people are not at risk. That isn't true. What we found with increasing studies and increasing exposure to the virus is that everybody is at risk. So that is the first step. What does one do to prevent infection? We have found repeatedly that the 3 W's are important, and if you can keep that in mind, it's easy to follow. Number 1, wear a mask at all times. If you have a vulnerable person in your family, someone who is 80 plus years old, has a heart condition or whatever, and you're going and working outside and you have contact with people who may be carrying the virus, wear the mask in your home as well. Number 2, wash your hands frequently. One of the most problematic things in India, and I bet you in Bangladesh and in many other poor low-income countries, people do not wash their hands frequently. They do not wash their hands as soon as they come home. They do not wash their hands before they eat. They do not wash their hands after going to the bathroom, all of which are important. So first W, wear a mask. Second W, wash your hands frequently. When you wash, wash with soap and wash for at least 20 seconds continuously with water and soap. We try to tell the children here, sing the happy birthday song when you wash, and finish the washing when you finish singing the song happy birthday, because that's how long you have to wash your hands. The third W is watch your distance. That's an extraordinarily difficult thing to do in an overcrowded country, for example, like India, or in some parts of Bangladesh, or the market, or the streets even, where people are always close to others. So distancing is going to be your most difficult thing to do. May not be for people who are well-to-do Rotarians, but for the average person living on the street, for example, or a homeless person, or someone who's living in some kind of a shack because they are temporary workers, that is going to be very difficult to do. So the people who are affected the most, even in the United States, which is considered a wealthy country, are people with lower means, people who live in crowded situations and have pre-existing conditions such as heart disease, diabetes, and other immunosuppressed conditions. So someone who has just had cancer, somebody who is on treatment for a lymphoma, for cancer of the pancreas, whatever, breast cancer, they are more likely to have immunosuppressed conditions. The next thing, in your day-to-day tasks, what must you be doing? You must make sure you are well-rested and you eat well. When we say well-rested, that means, including healthcare workers, you must try and get as much sleep as you can. Why is sleep important? Because sleep does happen to promote better immune response. So you really need to sleep through the night and be rested. 2, if you have an exercise routine, stick to your routine. Have a structure throughout the day. The structure means if you were going to work and you used to exercise a certain time of the day, you used to eat certain meals, you used to get some fresh air outside, stick to your routine. Have a structure through the day. Third, do not bring your work into your bedroom. Do not bring your computer into your bedroom. Do not watch TV in bed. Do not eat pizza in bed. Do not bring biryani in bed. Have that separate from your bedroom. The bedroom is for just sleeping and for other activities that are considered, sexual activities with your partner. You do not have any other activities in your bedroom. Lastly, do not neglect underlying medical conditions for which you go to your doctor. Call your physician, make sure you're doing your regular checkups, talk to your doctor about having a visit. Some of us have restricted visits to Zoom in this country. They're not doing in-person visits, but if you need in-person visits, your doctor can advise you on what is to be done, and they will arrange it in such a way that the waiting room is not filled with people. So do not skip your usual doctor's visits. Lastly, as Rotarians, we have to think beyond ourselves. Think about your neighbors, think about your other colleagues, think about other people for whom you might have the ability to lend a hand. Let's say you live in a building, in a condo, in an apartment building where there's an elderly woman living by herself. Think about whether you can deliver medications to her. Think about whether you can deliver prepared meals to her. These arrangements are better made in areas where this is freely available. And frankly, that's better done in a place like India, where someone can be paid to deliver it to your home. It's much more difficult in the United States, where everything is very costly, including the labor of somebody driving to your home to deliver something. Groceries can be ordered online here. I'm not sure how that's done there, but you can certainly ask groceries to be delivered to your home to limit contact with others. The higher the contact with multiple people, such as at a bar, at a party, even in somebody's home for a religious gathering, exposes you to a much higher risk of the virus. So the last thing I'm talking about here is controlling and organizing your behavior. We have to set an example for our younger people, because many young people do not understand the gravity of what this virus is. Now, to leave this on a good note, just yesterday at the School of Public Health, we were going over what treatments are available. So prevention is the absolute best thing to do, but beyond that, what do you do when indeed somebody is ill? So even now, there are hundreds of studies being done to figure out what would be the ideal response and at what time. So the therapeutics and the timing of the use of medications is being discussed. So something with a mild to moderate illness, your doctor will tell you can be taken care of in your home. You'll have to self-quarantine for 2 weeks and then move on. If indeed you need admission, there are antivirals prescribed, there are steroids prescribed, and there is convalescent plasma that's given. If you indeed are moderately to severely ill, where you're having respiratory failure, they're going to start you on oxygen and anticoagulants right from the beginning. But those are the only adjuvant medications we are providing at this time. If you have severe respiratory distress syndrome, then you're going to be put on a ventilator. So essentially, there are levels of care that are provided based on the latest research that are being constantly revised. But the important thing is to make sure that you have somebody that's your advisor in terms of a physician with whom you can have contact and talk with that person. The positive thing about all of this is that there is very rapid, very intense research going on to figure out what kind of vaccine to give the general population all over the world. So there are many companies working on this very diligently that are in what we call phase 3 trials already. The phase 3 trial means a trial in a very large population of thousands in order to make sure that, number one, the vaccine is effective, and number two, that it is safe. So we are waiting to see when these will emerge. We're hoping, as in the United States, as has been displayed on the news, we're hoping it will be available by early spring next year, as discussed by Dr. Anthony Fauci, who is our biggest infectious disease specialist in this country and perhaps in the world. So the positive thing is that there will be a solution. How long it will take is not very clear. The people who are in the military and in healthcare situations will get the vaccine first, and it's very likely that elderly people will get it as well. There are different forms of the vaccine being manufactured that are both injectable as well as vaccines that may be orally manufactured and swallowed as a pill, just like we do for the polio vaccine in Rotary. So the good thing is that there are many brilliant minds working on effective solutions. So the question is, how long do we put up with this and be patiently structuring our day in a similar fashion day after day. The biggest boon we have in this generation is IT. Look at this. I couldn't have done this physically with so many of you before. Now I can. And we can have our socialization online with people on the phone, talking to one another, celebrating with one another, and discussing issues with one another. Another good thing that's emerged in Rotary through the discussion of COVID is that we find that we can decrease our costs by not meeting in person for many things. So there is hope for a cure. The cure, it will not be long in coming because they have fast-tracked the development of a vaccine way more than they have ever done before in the world. And number three, it is up to us as Rotarians to continue to support those people who need our advice, our skills, and our money in order for them to survive. I'm going to stop there. I thank you for your patient listening.
Thank you, Dr. Geetha. We'll have some question answer session. Before going
Yes.
to the question answer session, I'd like to welcome our District Governor, MD Rubaiyat Hussain. District Governor MD Rubaiyat Hussain is here with us.
Which one is this? I'm sorry. Who is this?
District Governor MD Rubaiyat Hussain, our District
Let
Governor.
me look. Let me look.
Rubaiyat Hussain.
Okay, I'm looking for his face.
You will find her. You will find him by searching with DG.
Requesting District Governor to say something.
Thank you, Farhan.
Oh, so, okay. So he
Thank
doesn't
you.
have his face on there. Okay, got it.
Thank you. Yeah, I'm Rubaiyat from the District Governor.
Yes.
Thank you very much, District Governor-elect from
7620.
761320.
Yes.
District Governor-elect Geetha is a very nice presentation. Excellent. And this is the pandemic situation, a very relevant subject. I'm in meeting, two or three meeting where I'm joining with, the past RI First Lady, his prayer meeting also hold on. And I have my two PDCs in my office. We are getting another meeting. I'm congratulate Rotarian Farhan and Shiraji to organize a nice meeting, and all the members of the both clubs. I'm enjoying this meeting, everyone, and hope so we are do some new things in Rotary, and we go forward to our country, to all the Rotarians in the world, to do something for the mankind. Thank you very much. Thank you again to give me a invitation for this meeting. This is a very innovative meeting. Thank you very much.
Thank you. Thank you.
Thank you, Geetha. See you again, I hope.
Yes, I hope so. I hope we meet at the international meeting next year.
Yeah, sure. Thank you.
Thank you, District Governor, for being present with us. Is there any questions for Dr. Geetha? We have a question and answer session.
Yes, I have a question. Can I ask a question?
Yes, go ahead. Go ahead.
Are you using any medication for this pandemic, mental depression, or just counseling the public or patient?
Yeah, for both. So we use medications like we would always use for depression and anxiety. And we also are using relaxation techniques, yoga, mindfulness, and meditation. And psychotherapy like we always do. And although I'm not actively seeing patients at this time, a number of my colleagues are, and they're doing more Zoom meetings because patients are not always being seen in the office face-to-face because of constrained space requirements. And they're also going through teaching techniques for for them to deal with anxiety and to deal with their depression like we always did. What we're finding, though, is that it's affecting a great deal of youngsters from ages 15 to 24, 30, because a number of young people who were supposed to be going to college, supposed to be embarking on their careers and working on finding a career goal are finding it very hard during this time. And in the low and middle income countries, there's an increased incidence of suicide. So I would suggest, if you're working on something to help young people in your country, they are, after all, the people who dream and lead the country forward. I think it's extraordinarily important to set up maybe a suicide hotline where people can call and get advice. This has been done in other parts of India. It was done in Lithuania. And it's very important for young people to know where to turn for help.
Do you have any suggestions for doctors who are dealing with the COVID patients, just like me? I am an assistant professor in cardiology working in Dhaka Medical College, and for fighting with the COVID patients for last couple of months in Dhaka Medical College. And just I finished my rotation day before yesterday. So I am feeling very anxious. I'm not getting good sleep. That's the problem. Yeah.
Yes. So one of the things we have done at Hopkins and trying to help our colleagues is we've set up a separate line for all of us as the faculty to help out our own colleagues who are under stress. So we have something called, this is something we developed many years ago, called the Second Victim Program at Hopkins. And what that means is that you have an internal group of people, including psychiatrists, nurses, counselors, and social workers. They form a team where anyone can call that line and be heard in an anonymous way. They don't have to say who they are. They will not be identified. But that team is available to help people who are frontline workers, who are under enormous stress, because they not only are under stress with extra work hours and trying to help others, but they're also losing patients. And it is very hard to see, people dying and not take it home with you. So it becomes part of your bereavement because you're helping people that you can't rescue. And doctors, I know, feel the worst when they're not able to save somebody that they feel they should be saving. So it's very important to have an internal hotline set up in your college, and I would recommend that. Have a psychiatrist or psychologist or social worker. You have a team that takes calls from people like you. And we have found that being able to simply share their concerns and talk to somebody greatly helps their anxiety.
Thank you, Doctor. Rotarian Farhana Rizwan, you have a question? You have a hand raised. You can ask a question. Farhana Rizwan. Dr. Farhana Rizwan. Please unmute yourself. Dr. Farhana Rizwan, please unmute yourself.
Somebody else had their hand raised. I don't know.
All right. President Farooq, Bonani, Dhaka.
Okay, sorry.
President Farooq from Bonani Model Town, Dhaka.
Thank you, President Farhan. Give me the opportunity to ask something to today's speaker. We have observed in our country, some people are so much traumatized in COVID-19 that they're leaving their parents when they are affected in COVID. So it should not be. What would be your guideline for them from relief of this behavior? They should
when
not
you say, yeah, so let me understand this. You're saying when they have COVID, they're frightened to give it to their parents, so they're leaving them? Is that what you're saying?
Yes, like that.
Okay. So what we say is self-quarantine. What we do here, and my daughter had to go through this, so I'll tell you, space is a premium anywhere, you know, and particularly in large cities like LA and DC, you do not have the luxury of going to a new place. There's just no way to do that. So by self-quarantine, it doesn't mean you have to leave the house. You can have a room that's separate with one bathroom that only that person who is COVID positive uses for 14 days. So that person has to be just given meals as if they're staying in a hotel room. They don't come out. They don't come out. Sorry. So the person doesn't interact with the family members. They have to stay in the room. Only that person can use the bathroom. No one else uses that bathroom. No one else enters the bedroom. They wear a mask at all times. Someone opens the door, puts their little, you know, their thali of food in there in that room and comes out. Nobody is really interacting with that person. I know that's hard, but that's way better than leaving the house and going to a strange place. So 14 days of that, it can be done. You'll have to wipe down everything the person touches. That person's clothes have to be washed. You have to make sure that they are not interacting with the children. So everybody stays separate from the person who's infected. In 14 days, if the person is no longer symptomatic, that's fine. If that person is symptomatic, they have to call their doctor and take instructions about what to do.
Any more questions? I think Rotarian Farhana Rizwan is here. You had a question?
Yes, I have a question. Thank you very much, Dr. Geetha. It's a nice presentation and we really enjoy. I have two questions to you. If you give me the permission, then I can ask you.
Oh, please, you don't need my permission, ask.
Thank you very much. The first question that is, what is your opinion regarding the vaccine? Because we know that the strain of the virus is continuously changing. So is there any beneficial effect of the vaccine? What do you think about this one? Our the second question, what is your suggestion about the post-corona symptoms? Because we know there are some symptoms after recovery from the corona, or we know that is the COVID-19 patient. So what is your suggestion about this
Okay,
patient?
so Dr. Rizwan, I have to tell you, I'm not an expert in coronavirus, okay? I'm just an expert in psychiatry to a degree. But what we're finding out is, maybe you weren't in the room when I mentioned that there are different kinds of advances being made with the use of steroids, with the use of antivirals, with the use of blood thinners and other adjunctive medications, you know, in putting patients on oxygen and then treating any underlying problem that they may have. The vaccines are being developed with different parts of the virus that stop different activities of the virus. So there is no one single vaccine that I know of that's already out and up and about that to be used. There's nothing like that yet. So there are some vaccines that behave just like the virus in providing immunity. There are some vaccines that use the viral DNA, some use the viral RNA. There are many other, and there are some that act like immune modulators. So there are different aspects of the vaccines being manufactured across the world. They're not all the same. So as I mentioned before, some are injectable. There's also an effort to manufacture an oral vaccine. So there are 6 phase 3 trials now. We have no idea what the vaccine is going to be at the end of the trial. So right now, there isn't a vaccine that's being deployed and has not been found yet, okay? The second issue is for the post-corona symptoms. Even my colleagues who work in the general hospital haven't come up with a single model of what happens post-corona. So the different agents that I mentioned are used to target different side effects or problems that the virus causes. So to give, giving dexamethasone, for example, decreases the response in terms of respiratory difficulty and the immune response. It plateaus the immune response to a degree. Putting someone on anticoagulants prevents the mini strokes and the clot formation that clearly is a feature of COVID. Making sure that the person has oxygen means that they have a better ability to breathe. Positioning the patient in the prone position helps breathing more. It is not true that young people don't get it bad and it's only elderly people, because there are people who, there's one lady who was 103 years old and discharged successfully after COVID in New York. So it is not true that everyone who's old gets severely ill and everyone who's young doesn't get ill. That's not true. So as I said before, the only thing we know for certain is you want to decrease your risk of exposure as much as possible till a vaccine has been found that can be deployed across the world. And the biggest hope for Bangladesh is for the vaccine that's going to be manufactured in India, which India has promised will be given free of cost to all low and middle income countries. So that's the nice thing there, you know, people will not have to pay for it. So, like I said before, 3 things everyone has to do: wear your mask, keep your distance, wash your hands frequently. There's no other replacement for that.
Thank you, Dr. Geetha. We have 2 hand raisers. Rotarian Mashipur from RC Shyamoli-Dhaka. Can you ask your question, Rotarian Mashipur? Are you there?
President. Hello,
Yes.
President, this is Mahmoud speaking.
Yes, go ahead.
President,
Yes, please. We can hear you.
do I have your permission to put a question?
Yes,
of course.
go ahead.
Thank you, Geetha ji.
Yeah.
It's very nice to have you here in this fine evening. And it was my pleasure and very educative to listen to you. You covered so many things in so small a time. You have touched about the psychological effect of pandemic. Very briefly, stating only two things: anxiety and depression.
Yes.
That induces me. I wish to get your more advanced, some detailed instruction as to how we can build up our mental strength to fight this disease, because psychologically we are getting wrecked.
Yes.
Thank you.
Yeah, so this is a very different question than what has been asked before, and that is the issue of resilience. How do you increase resilience among the population? And so some of the things that we've talked about, where you try to structure your day, you try to do the best you can, you observe all the required practices, and you help yourself and others, that's one way. The other way to build resilience is to be able to talk with somebody about what exactly you wish to get through. So let's say you have all of the problems that we face every day simply gets magnified during this time. So you have a coworker who isn't following instructions, that's going to make you feel very anxious because that person doesn't do what you think that person should be doing. So there ought to be a committee or a group of people who help you resolve such issues. So resilience isn't something that happens automatically. There are a number of studies on resilience. Resilience happens in people either genetically, that they're born with a great deal of resilience, or resilience can be built up by working together as a team to think about steps we all take based on our collaborative effort and discussion about what it is we need to do. So for example, your Rotary Club says, you know, there are 5 people in our Rotary Club who are going through a very difficult time with their business. The business is down, they're not able to get any money and they're having a difficult time. You as a group will decide maybe you will forgive that person's club dues and district dues for that month or for a couple of months. Or maybe you will say, we'll pay your dues, your district dues and your club dues for this year so that you're relieved of that problem. So when you start to really help others as Rotarians, you will find your resilience increases.
Right, right.
There's Nasir has his hand up. Go ahead, Nasir.
President-elect
Thank you. Yeah, thank you. First of all,
Nasir bhai, Geetha Nasir is the next president.
Ah, very good. He
So
looks
that
like a
is
young.
new
He
year.
looks like a young man. So congratulations.
He is
Thank
a
you.
young man with the bald head.
First of all, I want to tell you that after so many months, I've seen such a beautiful lady like you and a
Oh,
very strong
wow.
personality because we are locked down. So in lockdown, we don't see many people outside. So my question
Thank
is
you very
simple.
much, Nasir.
First, my question is very simple. It's not COVID related. As a human mind, we can control many things, but we cannot
Yes.
control our dream when you sleep. When you sleep, we cannot control our dream. So, can you explain in your experience and knowledge that can you control dream and do something that we don't dream when you sleep? And
You can't do that.
How can you explain dream in your
Okay, so part of sleep is what is called REM sleep. During the REM, there are different cycles during your sleep. And sleep disorders are a very big area of expertise where there are physicians who work very hard at understanding what's called sleep physiology and structure. So sleep has semi-awake areas and deep sleep areas. And in order to be rested in the morning when you sleep, you need to have at least 2 cycles of REM sleep. And during REM sleep is when you dream. So dreaming is like the brain's effort to get rid of the day's work, okay? The brain's effort to work through the day's experience is REM sleep. So most people don't remember everything you dream, but you will remember things that you dream of just prior to waking up at the last end of the second REM cycle of sleep. So sleeping and dreaming is part of the brain's work in order to get its rest and in order for it to be energized in the morning. There's no way to not dream.
Okay, thank you very much.
মাসিক ভাই মনে হয় হাত তুলে রেখেছেন। মাসিক ভাই কি বলতে চান? মাসিক ভাই।
মাসিক ভাই বোধহয় মিউট হয়ে আছেন বা
হ্যালো, হ্যাঁ মাসিক ভাই আনমিউট করে আপনি প্রশ্ন করেন। হ্যালো মাসিক ভাই, can you place your question?
মাসিক ভাই যদি না থাকে অপূর্বদা মনে হয় হাত তুলে আছেন। অপূর্বদা কোশ্চেন করতে বলুন।
মাসিক ভাই বলছে, মনে হয় শুনতে পাচ্ছি।
Hello,
Yeah.
Dr. Geetha. I have one question regarding vaccine. Because we have already known from newspapers that Russia, they have come with a new vaccine, though we know they have not gone through the last phase of trial.
Yes.
So
yes.
If there is any chance of this vaccine to come in our country, is it safe to use it or not? I want your opinion.
Well, see, all I can tell you is, I don't know what the Russians are putting out there, frankly. Sorry about that, but I have no idea. All I can tell you from a researcher's point of view is until you go through the phase 3 of a clinical trial, which consists of both safety and efficacy tests, because you are now deploying it to thousands of people, until you do that, you have no idea what the fallout or the side effects are going to be. So to actually launch a vaccine without completing the phase 3 trial of the research is really being very irresponsible.
Thank you.
Yeah,
Thank you.
I would say trust the Indian group that's working with UK to deliver a vaccine because they're doing it the correct way.
Mr. President, can I get the floor?
You may ask question. Please.
Go ahead.
Okay. I have a basic question. As a layman, I want to know, so far I understand from the media as well as from the social media, doctors' opinion or their general opinions and all these things. But what I understand, the microbiology, I mean, the country to country, it is the body chemistry is different. That's why the corona itself is behaving area to area. Particularly in Bangladesh or India, the nature of the COVID in the European or American, whatever it is, the developed countries are a bit different in nature. So the vaccines are being invented or whatever is going to be coming up. Would it be same for this subcontinent or will we require something different with the condition of the human body, nature and all these genomes? What I understand.
Yeah, so Rotarian Shafiq, we're not sure about what resistances people have in terms of herd immunity to this virus in different populations. So I belong to a fellowship of Rotarian doctors who are from 50 different countries, 400 doctors from 50 countries across the world. And we have discussed this online. We have a Zoom meeting once every couple of months and we discuss this. So the doctors who work in African countries tell us that their patient, the number of people affected and the number of deaths is much, much lower in African countries and in India as compared to the United States. Now, why that is, we don't know yet. I mean, there's all sorts of speculation about what it might be. Someone is proposing the fact that we all get BCG at birth, maybe that provides some immunity, or we have had other, SARS viruses circulate in our populations in Asia, which might have protected us in some way. We don't know. It is also likely that in the US, they have never seen anything like this before. So the herd immunity may be just as low as possible. That's the theory. Other than that, I don't know much more.
That means in general opinion, what I think, do you think that the hope for the coming up the vaccines by Russia, America or advanced countries, but until we get vaccines really come up within our Asian countries, there is no hope for us. Can we think like that?
No, you can't think that way. The reason is that, I mean, look, you're a Rotarian. If we all said we have no hope, do you think we'd be helping others? I mean, no way. So just understand that the vaccines are being manufactured, two reasons. Number one, the people who manufacture the vaccines want to be the number one people to rescue the world. I mean, that's a huge coup for them, okay? So if I am from Johnson & Johnson, or I am from Sanofi, or whatever company, I want my company to be the number one company that manufactures the vaccine that rescues the world, because that will go down in history. But also, hey, I might win the Nobel Peace Prize for bringing the vaccine to the rest of the world. However, the second issue that you have to think about very carefully is, think about the fact that everyone has to self-quarantine when they travel. People are not allowed to cross borders. Even in the United States, we are not allowed to travel unless we are absolutely essential personnel from state to state in some areas. So the reason is, if you are not treated, you're going to carry the virus to an area where people have the vaccine. So there's no way they're going to deprive you of the vaccine. If nothing else, for their own selfish interest, they want to be protected. So they'll give the vaccine to everybody. So never say there's no hope. You wouldn't be a doctor if you said you didn't have hope, right? Yeah, I mean, as a Rotarian, we all go around creating hope. That's our job.
It is. So, Mashik Bhai, you have been looking for the opportunity. Please.
Can't hear you.
Go ahead.
Mashik.
He has to unmute himself.
He is unmuted, but his headphone is not working, I think. Mashik Bhai, we are not listening you.
That means what I like to mean that as a Rotarian, we cannot say others to do something or we cannot advise anything what I myself is not confirmed about that one. That means sort of prorated. That is one of our thing to go ahead. That's why I'm asking this question.
What I'm saying is you as a Rotarian cannot do anything except what is within your capacity. But we can't give up hope. This world will cease to exist if we give up hope. Can't give up hope. And you know, all of the billions of dollars that are being put into research is for a reason. And I'll tell you, there are two Chinese physicians, Chinese researchers at Hopkins, who are very systematically developing a vaccine. And they told us it would be definitely that their phase 3 trial will probably be done by next spring. So I haven't lost hope. You shouldn't. There's somebody else with their hand up. Leila?
Laila.
Rotarian Lala.
Can you hear me?
Yes.
Yes, hi. Hope you're well. I have a very off topic, not so much COVID related, more pertaining to your specialty. So I have an autoimmune disease, and it's not so known around in our culture. And I also had a very hard time finding a doctor who could actually say what was wrong. And finally, when I did find out, it's nothing major really. I might have like a light case of myasthenia gravis, but I can tell how it has an effect on my mental health. And I did not think it did. I thought it was just me I was too stressed or overexhausted. But as I studied it myself, because there was very little help available, frankly, over here in our city, did I understand that it might be related. Could you shed some light on that? Would be great help for me.
So anybody with a chronic illness of any kind, whether it's respiratory, whether it's cardiac, whether it's muscular, whether it's neurological, we are all prone to getting depressed if we feel that that particular condition is getting ahead of us. So I would suggest that you speak to somebody about it, you know, speak to a counselor. Now, there is a Hopkins Division of International Medicine, and you can certainly contact the international office to have them do a consult in your case and have them talk to you. But if you were someone that I was seeing, I would treat you if you indeed had the need for treatment for anxiety or depression. I would certainly treat it. It's not hard. It's very simple. And there's no fear and stigma in taking medication for depression or anxiety if you need it.
So the autoimmune can really cause it then?
Well, it depends. It depends. I mean, depression can be accompanying any number of medical conditions. There are conditions that directly cause depression, such as, you know, anything that affects the brain, and any nervous or other disease that affects the brain can cause depression. Someone who has multiple sclerosis can have depression. Someone who has chronic, you know, cystic fibrosis can have depression. So a number of people with medical conditions can get depressed, but it's very treatable.
Thank you so much. Thank you very much.
Hello.
Hello.
Yes. Who's that? Sorry, someone else.
Mashik Bhai mone hoy line e aschen. Mashik Bhai.
Can you hear me?
Yeah.
Yes, go ahead. Yeah.
Am I audible? Okay, thank you so much. After several times trying, I am now audible. Thank you all Rotarian friends.
And special thanks to Dr. Geetha, very nice presentation. Uh, uh, in fact, we know the definition of World Health Organization regarding health, that is not merely the absence of disease or infirmity.
Correct.
Uh,
Correct.
that is, we all are giving emphasis on our physical health, but we have to keep our mental health and our social, spiritual health also in order to keep our physical health. Yes, you know, uh, now after COVID, the other diseases like heart attack, stroke, and cancer, it is exaggerated because of to me, I may be wrong, that is for ultimate effect for mental health. We are not cared about our mental health.
Yes.
And during COVID, and we are thinking about post-COVID, a lot of our people are losing their job, their salary cut. Our business entrepreneur also facing fear of their existing sustainability. They are facing serious stress, anxiety, and mental health, and almost depression also they're facing. Do you think that we have to give more emphasis to protect our mental health and rather than physical health? Definitely, we have a lot of hospitals who are giving our treatment for physical health, but they are not giving much more importance on mental health. Do you think in our industries and corporate house and our healthcare services like hospitals and others should give more emphasis on mental health like psychotherapy, psychological support? And to me, this is very much necessary now to protect the physical health also. What is your opinion, please?
Yes, absolutely. You're right on target. So there are several issues across the world in low and middle income countries that cause mental disorders to persist. One is lack of awareness, like you said. So people don't know that this feeling of fatigue, not feeling like eating, not feeling like going out, not feeling like looking at, a music concert or a cricket match, all of this stuff can be part of a depression. People don't know that. So the first thing we have to do is raise awareness of what is depression, what is anxiety, and how common it is among people. 1 in 4 to 1 in 5 persons suffer from mental illness of some kind, and yet we fail to recognize it. So education about it, public service announcements, making sure that there is a number for people to call when you say, look, you have signs and symptoms of depression. Here's a place to call. That would be very important. That's the first thing. The second issue is lack of literacy. So a number of people who are willing to go for help really may not be able to read what's in the newspaper about an ad saying, will you please call this hospital if you need help? They may not know how to read. The literacy in countries like India and in Bangladesh and many other low-income countries is that literacy, particularly among women, is only about 31%. So what happens is we have to really push for literacy. Shekhar Mehta, who is the next incoming president of RI, will tell you, he's based in Calcutta, he will tell you that making sure women are literate really promotes their awareness and learning about mental illness. The third thing that is affecting a country like yours and like India is lack of resources. So even if and the young lady who talked earlier pointed that out, even if I want to talk to somebody about what I'm going through, there isn't a ready mechanism for us to use where we reach out and say, oh, I can go to this clinic and talk about this. Then there isn't such an available, ready network of care providers. Those are the major issues. the Ministry of Health in India only in 2016 put out what's called a Mental Health Act of India. Until then, they simply did not have a plan for mental health. Much more of the GDP has been spent on other intercurrent infectious diseases and illnesses. Very little is spared for mental health. So what can you do as a Rotarian? I suggest that you can't do anything by yourself, but there were many clubs, I think, involved in this conversation today. I suggest that you have a representative from each club join together and talk about what kind of mental health initiative you will take in your community. We have something called the Rotary Action Group for Mental Health Initiatives that we formed. I was one of the founders of it. We have people from 30 different countries on that website. Look it up. It's called www.ragonmentalhealth.org. And there are many tools and many suggestions there for people to set up something in their own community. We have, slides for people to use. We have tools for evaluating depression. We have tools to teach about depression in high school and in other areas of the community. I would suggest that you form a support group that actually has somebody available. So Rita Agarwal, she's in Maharashtra. She's part of our mental health initiative. Her number, her contact is on the Ragon Mental Health website. Please call Rita. She will be willing to talk to you in your local language and help people. She may be able to set up, Zoom meetings and help others. She is going to be someone that you can contact anytime to set up something in your time zone because it's much easier. And Rita has volunteered to help.
Thank you. Thank you so much for your very nice suggestions. And
so the last thing I want to say is someone young like Nasir, I wanted to say, during my year, I'm going to set up what's called a Rotary Innovation Lab. Bangladesh is very advanced in IT. You have a lot of entrepreneurs in Bangladesh with this. I want to know from your group, someone who's a young person who's taking on the leadership of Rotary. It's very important that we allow our young people to come up with innovative plans, innovative solutions to things that we all haven't done yet. And I want you to write suggestions to me about what you come up with. But frankly, you can set up a young person, a young president's, network across the world. It's not hard to do. And if you do that, believe me, with many minds, you'll come up with creative solutions. There's somebody else, Mr. Mandal, Mr. Casey Mandal.
Yes.
Yeah, go ahead. You have a question?
Yes, I have a question. Thank you, Dr. Geetha Jayaram, for a nicely deliberation. I am Casey Mandal, Rotary Club, Shyamoli-Dhaka. I am an elder person of about 65 years with some chronic disease like diabetics, heart disease, and etc. I am very much anxious about myself, my family members, my relatives, my nearby peoples, and others also. I am very much confined within my house, the four-walled room only. But what are we seeing now? By this time, 6 months are running. But we see the contamination rate in Bangladesh is very, very much lower compared to the USA, Brazil, even in India. Nowadays, this question is here. What is I am very much mentally stressed that whether I am going out publicly or not.
Yeah, so one of the reasons in the United States, other than, medical or genetic possibilities, one of the reasons COVID has spread so much in the United States is because of people's behavior, which I think is very important to address. So in India and in Bangladesh, most people listen to the government orders to stay home, to follow lockdown. People were given passes to travel across states and all of that, which I think is very, very important. One of the reasons the virus has been so widespread and so persistent in the United States is because of poor behavior. Poor behavior. People went to beaches, people go to bars, they're having parties, all kinds of nonsense which should not be done. Okay? So part of it is their own responsibility for spreading the disease and keeping it going instead of bringing it under control. So a contingent from here went to Taiwan to see how wonderfully well Taiwan had controlled the virus, and much of it had to do with people's behavior. So the price we pay in the United States for having extraordinary freedom is also extraordinary infection. Okay? So in the East, in Singapore, in South Korea, in China, in Taiwan, the disease has been wonderfully controlled because they have stopped the spread. And when you stop the spread, you have enough resources to deal with people who are ill and can take care of them better. There are more hospital beds, there are available resources. Now in the United States, the spread, they also have a lot of travel in the United States, particularly in California and New York, which are the two hubs for many, many people from other countries coming in and going out. So in your case, I would say, don't think of it as, oh my God, we've done this for 6 months already, because you cannot think that way. You have to think about, how do I structure my day? How do I enjoy something today? How do I, make sure that things that I do on a routine basis, I can take care of? That's what you've got to focus on. We cannot focus on what went behind, because none of us knew this kind of thing was going to happen.
I think it's almost 9 here.
Yes.
So I think thank you very much to Dr. Geetha Jayaram for a.
I mean, I have thoroughly enjoyed this. It makes me think. It keeps me on my toes, and I'm sure Khalid will give a wonderful report on Monday to our club about you guys from Bangladesh. And I think you should encourage people like Nasir to become, president, someone young, forward-thinking, and carries the Rotary banner forward. I very much appreciate your including me in your discussion. Thank you so much.
Yes, Farhan also very young.
Just one more thing. Yeah, our current president also very young. Dr.
Yes,
Geetha,
yes.
just one more thing. That is that you have already come up with a Manasi model that has been recognized by WHO as well, and that is also running in India. So can we think of to have one kind of project, similar kind of project here in Bangladesh?
Okay, so
I've been going through the website actually, and it attracts me, and I thought that it can be a very good option for us to go through, because it is also.
But so I mean, it's taken. So let me tell you something. It's taken a huge amount of effort on my part, but also my husband's part. He is past district governor Jayaram Kumar. He's sitting in the room with me, listening to all this. So we have worked on it for 22 years. We've had many people give money, many philanthropists give me money, many of my classmates, people who believed in me and trusted me, and numerous Rotary grants. I think I probably applied for 9 or 10 Rotary grants, matching grants and other grants that no longer exist to put into Rotary, to this project. The project essentially consists of 3 players. One is a Rotary Club downtown in Midtown, Bangalore, which is a very, very important club and partner. Another partner is the St. John's Medical College, because you need a medical school and medical personnel to run this. And number 3, a number of philanthropists and people who gave grants and money to help this project. So the unique feature of this project is we conducted research and teaching. So it also includes mentoring and teaching of medical students, residents, nurses, and junior faculty. So we need the input of academia in order to understand what we're doing and whether we're doing it correctly and to assess outcomes. We've published a number of papers. All our papers have the Rotary name mentioned. A similar model was used in Lithuania. The Lithuanian Rotarians were just fabulous in doing this. A past district governor from there, Vygintas Grinis, took this model and employed it. Now their country is small. They have only like 2-point-some million people. So it was much easier to do. So they got the community involved, mayors, doctors, caseworkers. Everybody was involved in reducing suicide prevention, because the suicide rate in Lithuania, particularly in 14 districts, was the highest in the world, higher than even India. So I visited there twice. We toured the whole country. We made sure we met with all kinds of team players, everybody who was a leader in the community, and they all launched it together. The Vilnius University School of Public Health was involved. So we did mention the fact that we used academia to evaluate this. So they got the 3 pieces in place. They had Rotary Clubs, they got a global grant, they had community workers, and they trained lay people as caseworkers. So in order to detect mental illness and treat it and to screen for it, you do not need a super specialist like me. You just need community caseworkers who have high school education, who are literate and who can read. And why do we employ women? Because women are able to network better. They have open doors to get into someone's home. A strange man coming into a home where the male member of the home is not there is not going to be welcome. So women caseworkers across the world, in many African countries, in many Indian communities, are far more effective. So the idea is to have those three players in place, and to actually screen for, interview, and employ women who are high school educated, who live in the community, and can actually be reached by the local villagers. That's what is the success of the program. Now, we do have a part-time psychiatrist employed that we pay for. We do have, IT people that we pay for. We train a village woman as a data entry operator. She's our data entry person. So we believe, as a community psychiatrist, we don't believe that everything's done once you treat the illness. We also then believe in empowering the women who live in the villages. So, believe me, I've called singer in India, singer in America, and all that. I tried to get sewing machines because one of our patients became a seamstress. We sent her to tailoring school. She then educated a number of the village women. She has a tailoring school. I got 8 sewing machines donated. So now a number of village women can actually develop a tailoring business for themselves. Like that, like one of your members said, it's not merely the absence of disease, but also recovery to full function of the individual women. So rehabilitation and treatment and continued support for empowerment is very important. We've now put in a 3rd grant for Kenya. Our club is giving $50,000, and we will get some matching from the district and from RI. But for Kenya, already Jay and I have been there, and 3 of my nurses from Hopkins came, and we trained village women caseworkers. It's much easier there because they all speak English. But we then thought, these people live in shacks. They're 100 years behind India. I mean, they're using pit latrines. There's no door, window, nothing. It's just a mud shack that they live in. So we were figuring out, how do we help these people, We had gotten scooters for our women as caseworkers. I went and begged a club in Greenwich, which is the Wall Street club, and they gave me scooters that we donated. Like that, I was thinking, how do we help these women in Kenya? Well, they don't have. There's no gas station. There's nothing around there. So we were thinking maybe we should give them some bikes. But more importantly, one of my nurses decided, she did a GoFundMe program, and we gave each of these 12 women a cow, because now they can have milk for their children. They can sell the milk. They can raise their kids without worrying about paying for it. Like that, once you start small, start somewhere, it doesn't matter where, start small. But once you start, you'll begin to see the areas where you need further input. Now, like Khalid will tell you, he went to see the Rohingya children. once he saw them, and he did this on his own. He's done a phenomenal job, and he can tell you more about it. But when Khalid did that, he saw what are the other problems that exist. Where else should we be giving support? Now, he's gone back twice. This year he couldn't go because of COVID. But that's the kind of thing you start. Start with something small, make a visit, figure out who the village leaders are, figure out who the community elders are, get them involved. You will always find some good souls who'll be willing to help you. The reason I mention involving academia is because they're the ones who will do the outcomes assessment. They will give you academic tools. They'll be happy to say, oh my God, you've got a village of 1,000 people that we can evaluate. That's good. They'll publish papers. They like doing that, and they'll help you.
Thank you very much for your kind direction. I will be in touch with you in further if I need further advice or anything.
Thank you, Mahi, for arranging this. We appreciate it.
May I have, last but not the least, a question, a proposal to you? This is Rotarian.
Yeah. Yes.
My proposal is the best achievement of Rotary is eradication of polio.
Yes.
As far as district governors, you will have the upper hand to raise this issue also. It's a global issue, and to have some thoughts and ideas how to address this pandemic situation and what can be the role of Rotary in this sector.
Yes, so Rotary International has already thought about this, and they're using the polio health workers who are going into the fields to educate people about COVID also. They're using the same network that we already have established.
The backend chain that has been established for polio has already been started or in action for this COVID awareness and COVID protection actually. So that is going on, Shafiq Bhai.
Yes.
Not only that, the Ebola factor that has been actually protected through this polio backend chain.
To the network, yes?
Yeah, right.